Okay, so today we're doing some reflex testing as part of your neurological examination to identify possible brain injuries or damage to nerve pathways or any muscle disorders that you may have. Okay, so it's just going to be a series of non-invasive and non-painful examinations, mainly done with the reflex hammer here. Just a few light taps on different parts of your body. Okay, like I said, it's not going to hurt. It's not going to be painful, even if there is some muscle dysfunction or what have you. Even if we do find something wrong, this is just a way to identify it. It won't be painful, even if you have any of these disorders. Okay. Okay. So, my name is Dr. Birch, by the way. What's your name? Okay, let me just get that here. Okay, date of birth. And home address. Okay, so good. You ready to get started? Great. Okay, so just get my gloves here. I won't be needing to touch you too much, but just a bit for some of the reflexes. Okay, so we're starting with the deep tendon reflexes, and we're starting with the muscles of your arms. So first up is the bicep. So if you could just sit down like you're sitting down now, just bend your arm at the elbow and rest your forearms and your hands in your lap, okay? And just relax, okay? Okay, so I'm gonna take the hammer here and I'm just gonna lightly strike the biceps tendon just above the elbow joint while you have your arm slightly flexed, okay? Okay, and just feeling around here. So we have the muscle and we have the tendon. That's what I'll be striking, okay? Okay. Okay. Looks good. I'm just doing each tendon a couple of times just to confirm that we're getting the reaction that we want. Just a slight contraction of the muscle. Good. That's good. Okay, so we're doing the other side here. Okay, what we're seeing is, like I said, a contraction of the muscle and a slight flexion of the forearm. Good. The biceps muscle is innervated by C5 and C6. It's the cervical vertebrae back here, respectively 5 and 6 from the top, from the brain stem. Just try it again. Good. Okay, let's move on to the triceps. So the other inner side of the upper arm. This time I'm just going to ask you to let your arms just hang loosely down by your side. Just dangle them out from, loosely from the shoulders. Okay. And again, I'm just striking just above the elbow joint on the triceps tendon. Okay. This is a muscle that is innervated by C7, so just a bit further down than the rest. Okay, ready? Okay. That's good. What we're seeing here is an extension of the forearm. So the arm is straightening. And that's just what we are looking for in healthy individuals. Okay, good. Okay, let's do the left arm here as well. Good. 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 Okay, just write that down. So for biceps and triceps, we have a normal response. Okay. So next up is the Brachioradialis reflex, and that's in your forearm. So if you could just again rest your arms in your lap, gently turn them inwards. Exactly like that. Okay. Now, are you sitting comfortably? Just sit straight up, straighten your back, just like that. Good. And just relax, okay? All these exercises or these tests, they really do work optimally if you're not too focused on what I'm doing with the hammer and when and where I'm tapping you. So I don't want you to flex unnaturally in any muscles or be hyper aware of, like I said, when and where I'm striking you. Okay? So just do your best to relax. Okay? Good. Okay, so arms just relaxed in your lap. Okay? And I'm just striking the brachioradialis tendon. Now this time just below the elbow joint. Okay, there. You can feel that. So that's the tendon, and here we have the muscle. Okay, just what we're looking for here is flexion and supination of the forearm, or the forearm to bend and turn outward. Layman's terms. Just like that. And again, I'm just as much checking the muscle itself and the contraction there. Excellent. Okay, so we're moving now over to the other side here. Just relax. Okay, again, locating the tendon here. And the muscle here, brachioradialis. Brachioradialis, of course, because it runs along the radial part of the forearm. Maybe, you know, the radial bone as well. On the thumb side of the forearm. Good flexion, good supination. Just relax your arm. Just relax. Good. 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 Okay, so that's all the responses that we were just note them here. Brachioradialis. Okay, so now we're moving down the body actually to the legs and to the knees, specifically the patellar reflex, also known as the knee jerk. This is the most typical reflex that most people know about, I think, because it's very easy to induce in others and yourself. So if you're just sitting comfortably there and just dangle your lower legs out from the chair like that, exactly. Okay, so I'm going to strike just below the kneecap, okay? Good. And what we're seeing is the legs just bending forwards. I'm striking here the patellar tendon. I'm not striking the kneecap itself. That might hurt just a bit, but we don't need to do that. In fact, we shouldn't do that. Okay, that's good. And do the other knee as well. Okay, so you ready? Well, you don't even need to be ready. I'll just... Good. 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 So the patellar reflex is innervated by what we call L4, the fourth vertebrae in the lumbar spine. So the lumbar part, lower part of the spine, almost at the bottom. And of course we have nerves running all the way from the lumbar spine and the spine down, innervating all the tendons and muscles of the leg, all the way down to feet. It's good. Excellent. Okay. Great reflexes. No problems there. So again, you could just stay sitting like that, and we'll go over to testing the Achilles reflex. Okay, so just down here and just grab hold of your foot just like that, and I'll strike on the back of the Achilles tendon. There. Okay. I'm looking for a plantar flexion of the foot, meaning that as I'm seeing you do, the foot is pointing downwards when I strike the tendon here in this fashion. Okay, good. 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 That's good. Mm-hmm. Good. And I'm doing both feet as well. Good. 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 Okay. Now that was all the deep tendon reflexes done. No problems there. So I want to test your superficial reflexes. So that will not be done with the reflex hammer, but rather by stroking different parts of your body, starting with the soles of your feet. So this is testing the plantar reflex. Okay, so I'm just going down here and I'm just removing your shoes. There and there. Okay, and now I'll just be striking the sole of the foot from the heel to the toes. Okay, like that and like that. Good. Okay, that. And like that. Good. And what we're seeing, just as expected, is a plantar flexion of the toes, meaning the toes are curling downwards. What we do not want to see is the Babinski sign, which is dorsiflexion of the big toe and fanning of the other toes. But that is not present here, okay? So that's good. Okay, that's fine. Okay, so I want to test a few pathological reflexes related to your face here. So I'll just be getting a bit closer to you, if that's alright, and I'll be touching your face for this last portion of the exam. Is that okay? Okay. So I'm doing the snout reflex. That's not your nose, it's actually your lips. So I'm just placing my fingers here on your lips and tapping my fingers here, okay? Good. Good. Okay, we're doing the rooting reflex. I'll just be stroking your upper lip here. Good. 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 Okay, give me your hand. Okay, palm up. I'll just stroke the palm of your hand right here. Right hand. Good. 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 Okay, so these are they're called pathological reflexes because we don't actually want to see a reflex here. I just want to see a steady hand when I'm stroking here like this. And the same with the left hand here. For example, if you were to grasp my hand when I did this, the so-called grasp reflex, that would be a reversion to a primitive response and indicate a loss of cortical inhibition. So we need to look further into that with the neurologist. There's no grasping reflex here. Okay, and there's no palmamental reflex either, so no contraction. I see here. Okay, turn your hands like this. Okay, and I'm just gonna flick the nails or your fingers one at a time, okay? Tap them, okay? Good. 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 And the other here, left one. Good. 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 So here we, good, don't want to see any of the other fingers moving. When one finger is stimulated this way. Let me just do the right again here. Good. 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 Okay, so we're just about done actually. There's one last test, and this is the Patellar sign. I'm going to place my hand on your forehead like this, and I'll just tap it very, very lightly, okay? Good. Excellent. So I was tapping you several times to see when you would stop blinking as a result of my tapping, because the normal response is to stop the reflexual blinking after about 5 taps, and that's what I observed in you. So that is excellent. Patellar, no indication. So, like I said, that was all of the reflexing testing done for today, and I saw no sign of disorders of any kind. So, yeah, I'll note that in your file, and I'll see you for the next exam. Okay, so take care until then, and stay hopeful.